Have you ever wondered what happens in a school when certain topics become forbidden? When laws are passed that restrict what teachers can say and what students can learn about themselves and the world around them? These aren't just hypotheticals. Across the country, laws often nicknamed "Don't Say Gay" or "No Promo Homo" laws are being debated and enacted. These policies limit discussions of LGBTQ+ identity and issues in classrooms. Proponents often say these laws are about protecting children or preserving parental rights. But what is the actual impact on the students these schools are meant to serve? Let's unpack how these political bans can directly harm student health. When a school environment becomes a place where a student's identity is silenced or treated as inappropriate, it sends a powerful and damaging message. It tells LGBTQ+ students that who they are is something to be hidden, something shameful. This can lead to significant feelings of isolation and loneliness. Imagine being a teenager, already navigating the complexities of growing up, and feeling like you're the only one like you, or that even mentioning your family or your feelings is against the rules. This isn't just an emotional burden. It has tangible effects on mental health. Research consistently shows a link between experiencing stigma and developing mental health conditions. A 2023 study published in the journal Pediatrics found that LGBTQ+ youth in states with restrictive school policies reported significantly higher rates of recent suicidal ideation compared to their peers in more affirming states. The data is stark and speaks to a crisis. When schools are forbidden from discussing LGBTQ topics, it doesn't just erase identities. It erases access to vital information and resources. This includes access to supportive faculty, school counselors, and even health education that is inclusive and relevant. Students may not know where to turn for help if they're being bullied. They might not learn about safe and healthy relationships in a context that applies to them. This lack of information creates a vacuum, and unfortunately, that vacuum is often filled with misinformation, fear, and prejudice. It fosters an environment where bullying can thrive without consequence. The Trevor Project's 2023 National Survey on LGBTQ youth mental health found that 41% of LGBTQ+ young people seriously considered attempting suicide in the past year. However, they also found that having at least one accepting adult can reduce the risk of a suicide attempt by 40%. These laws actively work to remove those potential accepting adults, like teachers and counselors, from a student's life by threatening their careers if they offer support. The connection between a supportive environment and positive health outcomes is not a matter of opinion. It is a scientifically documented fact. The impact isn't limited to LGBTQ students alone. These laws affect the entire student body by limiting education and fostering an atmosphere of intolerance. When certain topics are off limits, it prevents all students from developing a comprehensive understanding of the diverse world they live in. It teaches them that it's acceptable to ignore or exclude a whole group of people. This can breed ignorance and prejudice, which are the root causes of bullying and discrimination. A school's job is to prepare students for the real world, and the real world is diverse. Furthermore, students with LGBTQ+ family members, like a student with two moms or a transgender sibling, are also put in a difficult position. They are forced to be silent about their own families, which can be incredibly stressful and isolating. It sends them the message that their family structure is less valid or something to be ashamed of, which is a heavy burden for any child to carry. This creates a ripple effect of harm that extends far beyond a single student. The American Academy of Pediatrics, the American Counseling Association, and the American Psychological Association, among many other leading medical and professional organizations, have all issued statements opposing these types of laws. They cite the overwhelming evidence that such policies are detrimental to the mental and physical health of young people. These are not political organizations. They are groups dedicated to health and well-being, and their conclusions are based on decades of research. They understand that affirming environments are crucial for healthy development. When schools are safe, inclusive, and affirming, students do better. They have lower rates of depression and anxiety, fewer unexcused absences, and report feeling safer and more connected to their school community. This positive environment allows them to focus on what they're at school to do, learn. When a student isn't burdened by fear, stigma, and isolation, their academic performance improves. The goal of our education system should be to ensure every child has the opportunity to thrive. Don't say gay laws create an environment that does the exact opposite, systematically placing barriers in the way of a student's health, safety, and success. It's crucial to look past the political rhetoric and focus on the real-world consequences of these policies. The health and safety of students should be our number one priority, and the data clearly shows that these bans are causing significant harm. For more deep dives into topics like this, make sure to follow and subscribe to Sex Education Repo.